Welcome back. President Cyril Ramaphosa is addressing the nation tonight as COVID-19 cases increase sharply. It's standing at 402 currently. Now, the president is set to announce new measures. Our political editor, Vuyo Mvoko, joins us live at the Union Buildings ahead of that announcement. Vuyo, we're expecting stricter measures.
We are indeed, but no time yet set for that briefing as to when exactly it's going to be. But yes, everyone is looking forward. The presidency confirming earlier in the day that the president will indeed address the nation. Tonight we are all waiting for time. Now, lots of possibilities, certainly from what the law allows, but to help us through the various possibilities, the options that the president has, I am joined by our colleague Karima Brown. Karima Brown, right now where we are in the state of disaster which was declared over a week ago. Now, certainly from a legal point of view, we're not looking at a state of emergency because the situation as it stands doesn't meet all the criteria set for a state of emergency, which means that something in between is a lockdown.
Absolutely, Vuyo. I think it's important to understand factually where we are since last Sunday, or 2 Sundays ago. We are in a state of national disaster, which gives the president the power to unlock certain resources and to promulgate resolutions that prohibits the movement of people. We've already seen the regulations promulgated by the Minister for Cooperative Governance, Nkosazana Dlamini Zuma. Now, with a lockdown, what we will see is the army moving in and putting further restrictions on the movements of people. And when the army comes in, they normally provide support to the police. But in a situation of a lockdown, they will then supersede the police and they will take over. And that means that we will have even further curbs on our movement. We've just seen the city of Cape Town, for example, closing all the beaches. We've seen in some places in Gauteng, in Kraigle Park in Johannesburg, the army moving into a base there. We also know that deployment will be starting on tomorrow in KwaZulu-Natal. And of course, the call for that lockdown has grown. The South African Medical Association, that's working very closely with Health Minister Zweli Mkhize, is also calling for that lockdown. So I think, yes, we will see the movement of people being curbed. And I think, we need to break it down for people. So it means you can't travel for Easter, no overseas travel, children should be at home, and only essential workers will be allowed, and keeping your social distance from people, but not quite a full-on state of emergency as yet.
Because, for those of us who grew up under apartheid, having the army on the streets conjures up images, that we'd rather forget. But, it's a different scenario. Even the army, when it moves in, wherever they will be, they might be deployed. It won't be a question of they can do as they please or skop, skit and donor. They too are restricted.
Absolutely. If you look at the regulations that the army has issued, in which they, for example, cancel or leave of their members, they're very clear regulations that state that minimum force needs to be used, that civilians' rights cannot be trampled upon. We live in a constitutional democracy. I think the big issue with a lockdown is the restriction on movement, and we know what that means. That allows the state to then go in and scale up the testing, track the disease where it is, and hopefully get in facilities where people can be treated and the disease, the spread thereof, can be curtailed. We've managed to push the disease back in terms of people who've traveled overseas and to high-risk countries. The big issue for us now is to curb the spread of local transmissions, particularly because we have very densely populated areas, particularly in Gauteng, where we have the highest numbers. We have huge informal settlements. A lot of the people who live and work there service your big industrial areas. If you think of places like Alexandra servicing Sandton, if you look at areas around the inner city of Johannesburg, so that's where the movement is going to have to be restricted more than we have now. We've seen today still various various premiers in the case of KwaZulu-Natal, meeting with religious leaders, a lot of so-called independent churches outside of the South African Council of Churches, giving the government a bit of uphill on shutting down their congregations. And what we need is greater cooperation. So I think that is what is going to force our hand in terms of the lockdown.
Okay, let's leave it there for now. Karima Brown, our colleague, will of course be here dissecting it all, talking about the various possibilities that do exist. And Shahan Ramkissoon, important to underline the point that yes, indeed, as the President said in his newsletter this morning, a lot of South Africans have cooperated in their numbers, and they are with the government on this one. However, there are still pockets, whether it's through negligence, whether it's through lack of information, or whether it's actually people putting their own interests before those of everybody else. But something has to be done to ensure that everything is in fact done to curb the spread of this pandemic without, of course, trampling on the human rights of everybody, and that the government is very much aware of. Shahan?
All right, we're going to leave it right there. Our political editor, Vuyo Mvoko.